Good morning, Asiya, and thank you for accepting to do this interview for our students. I just wanted, you're going to share about your personal experience, but I wanted you to start by telling us, or telling me a little bit about, where you work now, even if you don't speak for your institution, you speak for your organization, but, where do you work and what's the big picture of what you're trying to achieve with whatever unit you're in?
Okay. So I work in the World Health Organization. I'm based in Geneva, in Switzerland, and my area of work is community engagement for quality, people-centered, resilient health services. I'm located in the Integrated Health Services Department, which is in the Universal Health Coverage and Life Course Division.
That's quite a
big title, isn't it? Talk about complexity.
Yes. So, we're at this conference here, sorry for the background noise, but we're at this conference here where we've been talking about integrated case management and as a key community health approach and institutionalizing it. And you spoke, and one thing that struck me out of your talk was how you emphasized issues of culture, of social history. Actually, you shared something personal about your history, which was very interesting. But you also talked about gender in advancing global health ambitions. So I know that this is a broad topic, but can you tell me a little bit more how you look at your work, at this work you're trying to do, and how you try to bring culture, social history, and gender in that work?
Yeah. I think it's been both a personal and professional journey. I actually started in community development when I was a teenager, working with youth groups Somali youth groups in Sheffield in the United Kingdom. And so a lot of what I do now goes back to those early days of community development, but on top of that, there's been a layer of working as a nurse. I trained as a nurse. I trained as a journalist. I've done public health. And over the years, I've my thinking and practice has evolved from working with communities in a way that I think that public health still has a very traditional notion of the relationship between the health sector and the populations that they're trying to serve. And part of what I'm doing is bringing together the experiences that I've had, the disciplinary knowledge, and I think the access to science, and we know a lot more now than we did 20, 30, 40 years ago, particularly around the connection between human beings and the importance of community to the development of the self and the personality. And I think in the context of health, we've got huge blind spots, and so part of what I'm doing is trying to hold a mirror or a light to those blind spots, which will help us understand how we need to shift our thinking from a very linear, technical, we're here to gain knowledge and then tell people what to do with that knowledge, to a way of working in public health which brings in health and well-being. So it's about the whole person, the whole system, and so moving away from the fragmentation that I think the era of the Millennium Development Goals left behind. I think that's a legacy that we're dealing with, where you had technical programs that were focused on eliminating or eradicating disease. And now we're in the Sustainable Development Goals era, which is much more about the collaboration that's needed to create and maintain healthy populations, but health can't be separated from education or housing, or they're all interlinked. And so I think the thinking has to shift, the practice has to shift. The disciplinary scholars and experts who are sitting in their disciplinary world have to shift. And I think it's much more about understanding the complex world we're living in and the complex issues that we're dealing with, and putting that knowledge and that sort of drive and those mandates around health together so that we solve problems and we build on the strengths that we have, rather than being fixated on a particular disease. It's important, but disease is only one part of what we have to deal with in terms of a healthy living human being that lives a life that is meaningful and that they feel that they have purpose and that they can contribute to the world.
Yeah, I'm often reminded of this: health is not only the absence of illness, etc., which we repeat but forget very often.
Yeah.
So we could talk about these issues for an hour, but as I mentioned, so the course we want our students to be thinking about management, and I'm really interested, this broad vision. We just got kind of the layer, the top layer of it, but this broad vision is to me really critical and very ambitious too. But you've got an office sitting in Geneva, and I wanted you to help us think about the levers, the management levers, the tools, the processes, how you can practically try to promote and lead the change that you want to see in global health. From how do you manage to do that work to carry out that vision? So I know that's another thesis, but I'd like to hear you start talking a little bit about that.
Yeah. People talk about technical leadership and management as two separate things. And I think when we work in institutions that have a particular mandate, and so there is health leadership that's required, and that means that you have to be trained in some specialism. So either in the clinical area or public health, or there's some sort of professional role that you have to fulfill. But all of these professional roles and areas of health come together in an institution, so in a health facility or in a health system. And we have to find a way of enabling those connections to occur so that instead of professions sort of working in their silos, professionals are working in interprofessional teams. And I think that what will become more important is how teams connect and teams work together, whether they are in a local health facility or whether they're in a large hospital. If we talk about the needs of populations which sort of have shifted from infectious diseases sort of dominating the health issues, where we're now in an era where you've got sort of the rise of cardiovascular diseases and non-communicable diseases. So people are interfacing with health systems over a longer period of time, and so they will use different parts of the health system. And so the challenge for those health professionals working in the health system is how do they work in ways that are coherent and that there is a continuum of care and support across the life course of people, particularly if they have several issues. I mean, it could have diabetes, cardiovascular, it could be multiple issues that they have. And so management then I think needs to be around how do we help people connect to each other and be able to work in teams where different knowledge and different experiences can come together in a way that you understand what the whole issue is. In terms of change and the levers for change, I think there's an important lever for change that we often forget, and that is an internal lever. And the internal lever that I'm talking about is that when we connect purpose and we have meaning in the work that we do, then that activates a certain motivation in us. That sort of helps us to transcend the difficulties, and we sort of try and see the challenges that we have, not as sort of being overwhelmed by them, but as a kind of, well, it's part of what I need to be doing. And I think we often forget that health professionals are human beings, and so the environments that they work in will shape who they are. How they've been trained will shape who they are. The cultures that they come from and the kind of communities that they've grown up in will shape who they are. And we don't recognize that when we have shifts in sort of societies and social systems, those shifts will become apparent in the way that health professionals deal with the work that they're doing, their resilience, their ability to be able to form relationships. I give you an example. When I was growing up in the UK many years ago, I knew who was living in my neighbourhood. Relatives were living across the road, and there was a social support system that was there for me as I was growing up, and there was a social support system for my mother and my aunties. You don't see that now. You see a breakdown in family structures. You see more people being mobile and living not where they were born, but living somewhere else. And so instead of the community being there, we have to start creating communities for ourselves. And so this whole notion of who community is no longer a geographical location, both in the developed world as well as in the developing world. Because as we heard in the meeting, there's sort of a tremendous growth in urban areas in many developing countries. And so the notion of, again, community is not a rural area, it's a mega city where people may still be connected to their families in the villages, but that sense of community is different. And I think with technology, with globalization, with access to social media, you've got also virtual communities. And so there is this sort of complex social environment where there's connectivity on multiple levels. But when it comes to health and the investments we make in strengthening health systems and in training our health workforce, all of that is missing. Mm-hmm. They get trained in technical knowledge, and they're not trained in the human dimensions. They're not trained in reflective practice. There are certain professional cadres where that is, and the nursing profession is one of them. And I know that there are public health faculties, schools in different parts of the world where reflective practice is part of the competency now. But in terms of global guidance on reflective practice, that we don't yet have that. And I think this is just reflective of the focus on disease eradication, elimination, and how health professionals that are now in leadership positions have been trained in the past.
So this is fascinating, and I very much liked how you look at health through the lens of relationships. I want to push you to talk about the not so exciting part about the daily grind of our jobs. I mean, I work in a large organization, and just like health happens in relationships, our work happens with relationships with different partners, which we need to engage in, with emails and meetings and trainings, and So I'd like to ask you, that's next to last question, but I wanted to ask you very specifically, as someone who carries that very rich vision, which is a required transformation in global health, in my view, also, but what are the practical things? Where do you spend your time? What kind of relationships do you have to develop? Is that through meetings, through trainings, through advocacy, to reach the countries, to reach the partner agencies? Can you describe your work as, starting from when you check your first email a little bit, and the kind of relationships and the kind of institutions and activities, bread and butter, that you need to have? I know it's not as much fun.
Of course it's fun. Of course it's fun. And I think part of what we have to do for ourselves is, as a professional, find what motivates us, what gives us purpose, what gives us meaning. And sometimes an organisation is able to do that because they articulate a vision and strategic objectives that really make a difference. And if you're the kind of person where you actually do want to make a difference, you gravitate towards institutions and professions where you're of service or you can make a difference. So I've been incredibly fortunate. I think sitting at the global level, you really need to have country level experience. You really need to have rolled up your sleeves and worked in those kind of environments where you need to understand how to translate daily sort of practice into sort of more strategic sort of organizational ways of thinking. And so you've got to have the detail as well as the big picture. And sometimes I've struggled with that. It's a learning process. I think shifting from somebody who is caring for patients to somebody who is managing teams, to somebody who is in a position where you are setting strategic direction and leadership, it requires a level of understanding that is sort of layered. And if you come in at this level and you don't have this level, then it's incredibly difficult to know what it is that you need to know that could help you in making a difference for the people that are really actually doing the day-to-day change. So as I sit at the global level, we are going through a period of transformation within the organisation at the moment, and so we have a new general programme of work 13, which is all about making a difference at country level. We have a new leadership team, and so we as WHO are transitioning from one way of thinking and doing to a different way of thinking and doing. And so now it's about impact at country level, aligning at country, regional and headquarters. And so the role of headquarters really is now sort of shifting and being aligned with how do we help make a difference at country level? How do we support our member states? What kind of guidance do they need? Where are the gaps? What are some of the research questions that we need, that WHO needs to be thinking about? And sort of what are the questions that we need to be asking that can take global health forward? And it's an environment, I think, where you need to connect individual purpose to institutional purpose, to making a difference that the institution wants to make. And if you have that, I think then it becomes joyful. I think then it becomes something that you enjoy doing. And so the relationships that you form with your colleagues or in your teams is around how do you make that vision a reality. And some people are ready for it and some people are not. And I read this book once. My supervisor actually gave it to me when I joined the current team. And it was a book that was called Building the Bridge as You Walk on It. And it talks about leadership. And I forget the name when I spoke to the author. But he studied leadership, not from a theoretical perspective, but from understanding in the real world how leaders actually lead. And he talks about, in this book, what is called a fundamental state of leadership. And that fundamental state of leadership is open to anyone, and it's not leadership which is leadership because you have your job title says director or director general or CEO. It's the individual state of leadership where you are responsible for who you are and how you feel and how you think and what you do. And I think that's where the real work is. Imagine an institution where everyone is conscious and mindful and reflective, and they know themselves and are self-aware and are able to know how they can connect with other people. That unleashes the collective intelligence of the entire organization. And that can happen at any point.
That's fantastic. Very inspiring. So I want to conclude with just asking you, if people are going to be working in global health, I mean, you kind of went into it right now, but briefly, people are going to go in global health and have a management role at any level. What are kind of the two key words that you'd want them to have in mind or to carry with them? And maybe leadership was the first one you brought, but do you have two key words or two key ideas that people should frame over the desk?
I think leadership is not about telling other people what to do. It's really about investing in yourself as a leader and investing in other people. And it's about the collective, it's about the team, it's not about the individual. And I think in the health challenges that we're facing is really about getting that connectivity and getting that sort of like humanness, that the human qualities, the human dimension back into the global health discourse, back into the way that we practice medicine or nursing or any kind of profession which is related to health. It's about people, it's about human beings. And if we don't have that connectivity as we grow up, or if we have been exposed to adverse events or traumas, that also influences how we experience the world and how we interpret the world and how we are able to build relationships. And so that sense of connectivity and that ability to connect, where we're not being reactive but we are being receptive, really has the ability to transform. And I think for anyone that's considering going into health, into global health, into a health profession, it's really about transformation. It's no longer about I need to learn something and then I apply it. We learn and we apply in a context and in a culture, and also in a knowing who we are. So I think knowing yourself and developing that state of leadership is a requirement if you're entering into an institution that requires connectivity, an institution that requires building the relational fabric of that system. And I think the 6 building blocks need to be connected, and it's the human beings that connect that. And I think that's where I would like to see emphasis on training and particularly training potential managers in health to focus on this aspect, because this is where we can make a difference. And the science is telling us that too.
Well, thank you very much. Thank you for all this time, giving me this time, giving the students this time. Thank you very much, Asiya.
Okay, thank you.